The deep fascia is modified to form the interosseous membrane, which keeps the two bones at an optimum distance, increase surface area for attachment of muscles, and transmit weight from one bone to another. Functions: the deep fascia helps in keeping the underlying structures in position and preserve the characteristic surface contour of the limb and the neck. It provides extra surface for muscular attachments and helpful in venous and lymphatic return. It is also assisting in their action by the degree of tension and pressure it is exerting upon the surfaces. The retinacula act as pulleys and serve to prevent the loss of power. In such situations, the friction is minimized by the synovial sheath of the tendons. Now, the dermatitis or eczema, there is a redness, swelling, itching, and exudation in acute cases, can become chronic, could be due to allergy, due to soaps and cosmetics. Albinism, absolute no melanin pigment is found and is usually an inherited condition. Herpes zoster virus causes vesicular lesions around the nasal and the oral orifices along a dermatome or along a nerve. It is responsible for causing chickenpox. Pressure sores: the skin slowly dies over the pressure site. That is the pressure sores in the lower back when the patient lies on the back for prolonged periods due to illness. Burns: it is a condition occurring due to too much heat or cold acids, alkalis, and electricity. If only the epidermis is affected, this burn is called superficial. If both the dermis and epidermis affected, this burn is called deep. And burn results in dehydration, shock, and contracture. You can see the degree of burns over here. Now, the benign pigmented nevus or mole. These melanin pigment cells are found in small numbers in the basal layer of the skin. These neuroectodermal cells may proliferate at the dermo-epidermal junction in the dermis to form the nevi of different sizes. The skin is pale in anemia, yellow in jaundice, and blue in cyanosis. Now, boil or a furuncle is an infection and suppuration of the hair follicle and the sebaceous gland. Now, the skin incisions should be made parallel to the line of cleavage or the Langerhans lines, which will result in formation of small scars. Here, they are made to the lines parallel to the lines of Langerhans, resulting in small scars. Sebaceous cyst is a common condition of the scalp due to obstruction of the duct of the sebaceous gland caused by either trauma or infection. If the duct of the sebaceous gland or cheek is blocked, leads to closed comedons or acne, and this condition may get worse, called the acne vulgaris. Scabies is a mild infection in which it is seen in the interdigital cleft, the genital region, where severe itching can be found. Now, deep fascia of the leg is helpful in venous return from the leg. The muscular contraction press on the deep veins, forming an effective mechanism of venous return. This contraction becomes more effective within the tight sleeve of the deep fascia. Planes. The deep fascia forms planes, and the fluid or pus tracks along these fascial planes. The tubercular abscess of the cervical vertebra passes along the prevertebral fascia into the posterior triangle of the neck or into the axilla. The retinacula help in keeping the tendon and nerves in position. However, sometimes the delicate nerve may become compressed as it traverses under the retinacula. Median nerve may get compressed due to the flexural retinaculum, leading to carpal tunnel syndrome. Similarly, the tibial nerve may also get compressed under the flexural retinaculum of the leg, leading to the tarsal tunnel syndrome. So that's all about the skin in the fascia of general